doesn't involve my town. This doesn't involve my parish. The numbers that we have today are once again very staggering. I hope the entire state of Louisiana is looking at these numbers and that they are as concerned about them as I am. Since yesterday, we've received 510 new confirmed cases of COVID-19 for a total of 2,305 cases statewide. That is a 28% increase from yesterday.
It's sort of like watching a train crash in slow motion. You know it's going to happen, but there's not much you can do about it other than the things that we're doing. So supportive care, whatever drug therapies that we're able to do. So I would say that's one. The second is that we are to some extent flying blind in our ability to treat people. I would say that from the diagnostic point of view, at the admission, we've gotten pretty good at picking who's got it and who doesn't, because the symptoms and the signs when they come in, especially in the severe disease, are pretty typical. I mean, so the radiology doctors, the ones that read the x-rays, can actually call it on the x-ray, which is, fairly unique, I would say. In a lot of these other diseases. So, but our treatment algorithms and things are not as robust as they could be. The amount of personal protective equipment that we have is adequate at this point. But I'm seeing around the country that people are running out, and that is a little bit of an anxiety for us. Our health systems that we work with here have been doing a good job trying to source the PPE and those sorts of things. I think that, and we're becoming innovative in terms of extending use and those sorts of things that as the CDC kind of gives us guidance with. But that is something that is a constant worry. Have we done the social distancing early enough so that we don't get the massive wave that's going to overtop us? I don't know what the answer to that is. I can just tell you that there's this increase that's going up like this day after day in the number of patients that are coming in and being treated. And so they're anticipating that the first week of April, and we'll just have to see what happens. New Orleanians are familiar with the federal response from a prior experience 15 years ago. And so that we, from the city's point of view, I think that the governor has sort of decided to kind of take over and run the show, which I think has been very good. My personal opinion is that the federal response needs to be as robust as it can be, which unfortunately it has not been.